Welcome to AMCI pre-class. This is not AMCI private class, no, but it's the pre-class. This is where we have informal conversations about medical coding topics. Topics that you say that you want more of, and we do our best. Although we tackle medical coding scenarios in pre-class, we also engage in non-medical coding topics by way of fun exercises to strengthen your knowledge. A lot of you all like the someone named it. One of the interns gave it a name, but pick the difference. I'll remember that name soon, but please forgive me. But anyway, we have fun, but these fun exercises are designed to strengthen your coding skills, your forensic coding skills. We also review AMCI assignments, announcements, and we even recognize our exam passers and star students in pre-class. So come on and join us. Got to get up early, 30 minutes before class. All right, let's get started. And before we go any further, I got a question for you. Do you know why Mrs. J uses blue notations when chunning? In other words, why does she write in the color blue? A, she likes blue. B, blue is AMCI's preferred color. C, black is not permitted in all medical coding exam required texts. Or D, black is not permitted in the CCS exam required texts. What say you? All right, so if you said D, that's correct. Yes, black is not permitted in the CCS exam required texts. So if you're taking your CCS exam or you intend to, like many of our AMCI dual certified students, you may not want to put black writing in your text. Why? Because CCS, well, Pearson VUE provides you with a black marker to write on a whiteboard, and they don't want to confuse that black marker with black writing, so it is banned. All right, I don't make the rules. I'm just the messenger. Okay, so what's our topic of today? Allergy testing and immunotherapy. You can find this subject in the medicine section of CPT. That's your 90,000 series. Allergy testing is a medical procedure used to determine whether a person's immune system reacts to a specific substance. Now, that substance, of course, is an allergen or the thing the person is allergic to. Now, these tests can be carried out various ways. The most common is the skin prick test. My children they had skin prick tests and they are not fun. Blood tests can be used and even diet eliminations. That is a form of allergy testing. Nonetheless, the results of the allergy tests can help the allergist identify those things causing the patient's reactions or the things the patient is allergic to. And the allergist will take that information and develop a testing or a treatment plan to manage or prevent allergic reactions. And I think prevention is the key. Now, allergy testing is a component of immunotherapy, right? And immunotherapy is pretty much allergy shots, and that involves exposing the patient to small doses of the allergen, what they're allergic to, and these shots are carried out over a period of time, and the goal is to reduce or eliminate the body's allergic reaction, or desensitization, or become immune to that allergen. All right, let's continue. All right, so an allergy test are when they introduce allergens into the patient. The most common way is the skin prick test. If the patient reacts to that allergen, then they have an allergy. And the results of that allergy test are used to create or develop an allergy immunotherapy plan, which we're going to talk about in a moment. But below you can see the skin prick test. The doctor introduces the following items into this arm. We're going to just review what's here. So histamine, feather, cat, dog, horse, sheep, wool were all introduced in as you can see, the patient reacted to histamine, feather, cat, dog, and horse, and is likely allergic to those things. Also, the patient is allergic to the following pollens. Plain pollen, yes, plain, an airplane, birch, grass, daisy. So the allergist will develop a plan, an immunotherapy plan to treat these allergies. And it will involve that they inject small subcutaneous injections into the patient over a period of time. They're going to introduce more and more and more, ultimately building a tolerance for these allergens. And also, in some cases, they use controlled exposure. They're just exposing this patient to these allergens. And the goal, the ultimate goal, is to develop immunity, immunotherapy. All right, so that's not always the result, but that is indeed the goal. All right, so let's go ahead and practice. Let's test our knowledge of allergy testing and immunotherapy. But before we get started, let's review how to solve a scenario. All right, so here are the mechanics. Highlight your key terms. At AMCI, we use the following key. Yellow is for diagnoses, green procedures, pink inclusive items, things that are bundled, or if you just don't know what to do with that term, but you think it's important, make it pink. All right, next, inventory or document. Write down your procedures, diagnosis, signs, and symptoms. Then select the primary diagnosis, the primary procedure. Then review your guidelines or FTRs. Then select the code that best matches your inventory list. And most important, the code that best meets a guideline if applicable. All right, now it's time to solve. Of the following answers, which best describes the encounter? A. 99202 with a 25 modifier, 95004 times 12. B. 99202 25 modifier, 95017 times 12. C. 99203 25 modifier, 95018. D. 99203 25 modifier, 95004. A 25-year-old female patient visits Dr. Smith's office for an initial visit. She has a history of allergic reactions to unknown substances. Dr. Smith carried out a medically appropriate exam and administered 12 allergy skin prick tests to determine the specific allergens the patient will react to. The patient reacted to 9 of the allergens. All right, you have a minute and a half to solve. Your time begins now. All right, time is up. How did you do? All right, first things first, let's go ahead and highlight our key terms. Initial visit, allergic reaction, exam, 12 allergy skin prick tests, the patient reacted. All right, is that what you got? All right, so if it's not exactly the same, it doesn't have to be. Now let's go ahead and solve. The first thing that I want to do is chun. Yeah, I got to chun my section because if you chun, it's going to eliminate a lot of things on site and it's also going to prevent you from wasting time. All right, so 95004 is for percutaneous tests only. 95017, combination that involves percutaneous and intradermal, and so is 18, but the difference between the two, 17 involves venoms and 18 drugs and biologicals. But all of them tell you to specify the number of tests. So on site, we know we can eliminate some because we know we've got 12 allergy skin prick tests. So if you have to specify the number, C and D are not doing that. But I want to turn our attention over to the guidelines right at the top of the allergy immunotherapy section. It provides you with this guideline, and this guideline says, hey, you don't code E&M services for test interpretation and report. However, you will code an E&M code if there was a visit that was separate and significant, right? So if you look, she came in for an initial visit. The doctor carried out an exam and administered the skin prick test. We're not trying to determine the level of the E&M code at this time because we don't have to. And let's go ahead and get rid of those things that are unnecessary. The answer is A, 9921225 modifier and 95004. And the reason, well, we already said C and D are eliminated because they're not coding for the total number of tests. But what's remaining, A and B, is 95004, which are percutaneous tests only, and 95017, these are combination tests. Nowhere in our documentation is combination, meaning percutaneous and intradermal tests administered, only the skin prick test. So we're going to code for 12 units of that, and that's going to be our answer. And the answer is A. All right, so that was pretty straightforward. A lot of you got that correct, and I'm happy. Now let's get to the good stuff. Let's talk about immunotherapy. And allergy testing is a component of immunotherapy. All right, so let's talk about what is allergy immunotherapy. Well, I mentioned the guidelines, and they are right, you know, right at where the section begins, allergy and clinical immunology, and the definition is here. Immunotherapy is desensitization and hyposensitization and is the parenteral administration of allergic extracts. So basically, when we're saying parenteral, this is not inside the digestive tract, outside of it. Okay? And pretty much they are introducing these antigens at periodic intervals, usually on an increasing dosage scale to a dosage which is maintained as maintenance therapy. And Indications for immunotherapy are determined by appropriate diagnostic procedures coordinated with clinical judgment and knowledge of the natural history of allergic diseases. All right, that's a lot. So let me break it down like James Brown. Right, so this is how it's done, and this is how we code for it. A physician begins by performing a detailed allergy assessment on the patient, and that includes a thorough medical history, physical exam with some medical decision making. All right. Then that provider carries out allergy testing. Then the office supplies the extract. So if the child is allergic to dogs, that provider who provides the extract or provisions the allergens will grab some dog from the shelf because they have it. They are providing it or provisioning it. Then the doctor or the office will go ahead and prepare the antigen, right? They'll mix it up, and then that antigen is administered in the form of immunotherapy. That's how it's done. Now that we're all pros, let's go ahead and let's code for immunotherapy. We may have to code for all of these elements, but when it comes to immunotherapy, you're going to code for the provisioning, you're going to code for the preparing, and you're going to code for the tests. So, what's important? You got to know who is doing what. Now, that's all the guidance I'm going to give you, and I'm going to let you go ahead, take it away. Of the following answers, which best describes the encounter? A. 95115, B. 95120, C. 95144, and D. 95165. A 9-year-old male patient has been experiencing severe symptoms from grass and pollen allergies. Doctors Adam carried out a medically appropriate history with low medical decision making, recommending allergy immunotherapy in the form of allergy shots to help the patient develop immunity to grass pollen. The patient arrives today for the first dose of immunotherapy. Dr. Adams' office supplies the allergens, and the clinical staff mixed and administered one vial of the first dose. All right, coders, do your magic. Of the following answers, which best describes the encounter? Your time begins now. All right, time's up. How did you do? Did you rock it like the star that you are? I know you did. All right, so this is what I did. I highlighted my key terms: grass and pollen allergies, immunotherapy, allergy shots, supplies the allergen, so the office supplies the allergens, and the clinical staff mixed and administered the allergens, and they did it by one vial of the first dose. So these are my key terms. Now what I'd like to do is I want to show you my chun. All right, so what I like to do, just like I did for testing, I like to visit the chun. The chun, it really helps. All right, so the answers involve 95115, and this is the code for professional services for allergy immunotherapy. And this does not include the provisioning, that's the supply of the allergen extract. So if they don't supply it, they're not mixing it. This is only the injection code for the doctor or QHP. Also, 95120, this is the doctor or QHP administering the injection code, but this is also for the supply of the allergen and the prep, so the mixing. So these two involve doctors. Now 95144, this involves the staff who are supervised by the doctor and or the QHP. And they do provide the prep and the supply. So they're supplying the allergen and they are prepping it. But this code is for a dose vial. And in the green, where you see the green parenthetical, the highlight over the parenthetical guideline, it says a single dose vial contains a single dose of antigen administered in one injection. So that is what that is. And 95165, this too is a staff administered or administration, doesn't necessarily have to be injection. There you go. And this is for the prep and supply of antigens. All right, so these are the codes, and hopefully you can see the differences. Now let's go ahead and solve. I'm going to document my keywords from the documentation and kind of match it with the key terms at the code level. All right, so my keywords: clinical staff, that's who is doing the mixing and administration. Also, the office supplied the antigen. Also, they prepared it and mixed it. Also, administered, it was administered by the clinical staff. And one vial. These are my keywords, and I think this is enough to solve. And if you look at the doctor codes, 95115 and 120, these are for doctors, and we've already stated that the clinical staff mixed it and administered it, so we're not going to code for professionals doing it. So let's go ahead and get rid of A and B. All right, C and D is what's left. These are codes for the clinical staff. And what is the difference between the two? Well, we know we have a dose vial, right? And 95165 is coding for antigens only, and 95144 is coding for dosed vials. So we're going to eliminate D, and C is our answer. 99144. All right, so you've got allergy tests, and you have allergy immunotherapy. The tests are a component of the therapy. You just pretty much code the test according to the number of tests, and you code allergy immunotherapy according to the supply or provision, the preparation, and the injection. All right, I'm going to hand it over to you. Take it away, interns.